Using radioactive seeds to treat prostate cancer has been around for a long time. It's a popular choice for many men because of the treatment time required and the minimal recovery time. It's also less invasive than surgery. Because there's no cutting in radiation therapy, some of the more difficult side effects of surgery can be avoided. But here's what I discovered during my research after being diagnosed with Gleason 6 prostate cancer at the age of 61 in 2007. The cure rate probabilities of seed implants only did not seem to be as high as cure rate probabilities of surgery. But the combination of radiation seeds plus external beam, which is done here at RCOG, did seem to offer comparable cure rate probabilities to the radical prostatectomy I discussed at Johns Hopkins. I then focused on the two main side effects, incontinence and impotence, and my probabilities on both of these side effects seemed lower with radiation therapy, making my choice for Prostacision clear. Prostacision uses a combination of seed implants plus highly targeted external beam radiation. 5 years after treatment, with a PSA level defined as 0 and minimal side effects, I feel sure that I made the best decision for myself. As a prostate cancer survivor who's been through the research and treatment journey, I now have the privilege of speaking with men about their concerns and helping them understand their treatment options in my role as patient navigator. I recently had the opportunity to sit down with Dr. Frank Kreitz, who created the Prostacision procedure, and ask him how Prostacision compares to other prostate cancer treatment methods, and this is what he had to say.
In my world, it's how well it works. If I had prostate cancer, I want to get rid of the cancer, not be treated for it. It's difficult to compare our treatment method with Prostacision because we calculate with, like the surgeons do, the surgical definition of less than 0.2, because others will not do that, other radiation doctors. But there have been a couple of reports, like for example, seed implants alone for prostate cancer, calculated with a PSA below 0.2, the cure rate's about 50%. So I say, and this is men with very early cancer, PSA is less than 10, Gleason 6 or something of this sort. Whereas, so I tell men who come to me and said, I'm thinking about seeds versus Prostacision. And I said, what you ought to think about is cure rates. The cure rate with seeds alone, and the only publication I'm aware of, is around 50%. So you ask yourself, you want a 50% cure rate, or you want something like we would give you as a 95%. And that's how you want to focus on the results. CyberKnife, there are no long-term results on that. Proton beam, there are no results that have been calculated with less than 0.2. I estimate they cure less than 50% of patients with proton beam. There's only a couple of publications in the literature, but they did not analyze with less than 0.2. They analyzed with this radiation definition, with astro definition, which does not reflect cure. So if you look at all these other radiation methods, or other, not just radiation, but cryosurgery or HIFU, and you ask them, using the surgical definition, how well do they measure up? They don't measure up very well. In fact, I would not have any radiation program or cryosurgery or HIFU for myself at all if I had prostate cancer, because the results, as far as I can determine, are not very good.
The physicians at RCOG can offer second opinions and cure rate probability projections to men who have recently been diagnosed with prostate cancer. I recommend, as a first step, requesting our free guide, Questions and Answers about Curing Prostate Cancer. Complete the form on this page, or call us and I'll mail you the guide, as well as this DVD right away. I'll also send you a link to my full interview with Dr. Kreitz, which I think you'll find to be both interesting and helpful. After reading the guide, if I can answer any questions or assist you in getting a second opinion from a physician here at RCOG, give me a call. And be encouraged. Prostate cancer can be cured. The key is to educate yourself, do as much research as you can, and get multiple opinions from doctors who have great reputations. I wish you the best in this journey.